Have you been dealing with burning, tingling, numbness, electric shock sensations, or pain that just won't seem to go away? Maybe it's in your feet, maybe in your hands. Maybe it's from diabetes, a back injury, sciatica, chemotherapy, or a cause that nobody has been able to identify. If that's you, I want you to know something important. You're not imagining it. Nerve pain can be incredibly frustrating because unlike broken bone or a visible injury, nobody can see what you're feeling, yet it can affect every aspect of your life. Walking, sleeping, exercising, and even your mood. Today we're going to discuss 7 natural remedies that may help nerve pain and what the research actually says about them. Now, I want to be very clear from the beginning. Natural doesn't always mean effective, and it certainly doesn't mean a cure. But some of these options do have evidence behind them and may provide meaningful relief for some people. My name is Pharmacist Michael. I'm a board-certified clinical pharmacist in psychiatry and pharmacotherapy with over 37 years of experience. And if you enjoy learning about medications, supplements, and living a healthier life, make sure to hit that subscribe button. Now let's get started. If I had to pick one supplement with some of the strongest evidence for diabetic nerve pain, it would probably be Alpha-Lipoic Acid. Alpha-Lipoic Acid is a powerful antioxidant that helps reduce oxidative stress, which is believed to play a role in nerve damage. Several studies have shown that it may reduce symptoms such as burning, tingling, numbness, and sharp nerve pain. Many studies have used a dose of around 600 milligrams daily. Now, is it a miracle supplement? No, but among other options, this is one of the most promising. One thing to keep in mind is that alpha-lipoic acid may lower blood sugar. So if you're diabetic and taking medications, you'll want to discuss it with your healthcare provider. This is one of the more interesting supplements when it comes to nerve health. Acetyl-L-Carnitine appears to do more than simply mask symptoms. Some research suggests it may actually support nerve regeneration and repair. Researchers have studied it in diabetic neuropathy, chemotherapy-induced neuropathy, and various chronic nerve pain conditions. Typical doses are often between 500 and 1,000 milligrams twice daily. Again, this isn't a cure, but if you're looking for supplements that may support the health of the nerve itself, this one deserves consideration. This one is incredibly important. Sometimes nerve pain isn't caused by a deficiency, but sometimes it is. Vitamin B12 deficiency can cause numbness, tingling, burning sensations, balance problems, and weakness. And here's the surprising part. Many people taking metformin for diabetes or acid-suppressing medications for reflux can become deficient over time. I've seen patients undergo extensive testing for neuropathy only to discover that low B12 was part of the problem. This doesn't mean everyone with nerve pain needs B12 supplements, but it does mean it's worth checking. Benfotiamine, a specialized form of vitamin B1, has also shown some promise in diabetic neuropathy. When most people think about omega-3s, they think about heart health, but they may have benefits for nerves as well. Omega-3 fatty acids help reduce inflammation and may support nerve cell function. The research isn't as strong as alpha-lipoic acid, but it's promising enough that many clinicians consider omega-3 supplementation a reasonable part of an overall nerve health strategy. And let's be honest, most Americans don't get nearly enough omega-3s in their diet anyway. Curcumin is the active compound found in turmeric. What makes curcumin interesting is its anti-inflammatory activity. Many researchers believe chronic inflammation contributes to nerve irritation and nerve damage. Some studies suggest curcumin may help reduce pain signaling and inflammation associated with neuropathy. The challenge is absorption. Regular turmeric powder often isn't absorbed very well. Be sure you choose a product with black pepper added. This enhances absorption. Now, I know some of you are rolling your eyes. Whenever somebody talks about chronic pain, exercise somehow ends up on the list. But hear me out. Exercise is one of the few interventions that consistently shows benefits across many different types of neuropathy. Regular movement may improve circulation, improve blood sugar control, reduce inflammation, and support nerve health. And no, I'm not saying you need to run a marathon. Even walking, swimming, or gentle resistance training can make a difference. The key here is consistency. A TENS unit is a small device that delivers mild electrical stimulation through pads placed on the skin. Some people experience significant relief from nerve pain using TENS therapy. Does it work for everyone? No, but it's relatively inexpensive, non-drug-based, and low risk. Many patients with sciatica, diabetic neuropathy, or chronic nerve pain report meaningful symptom improvement. If you have any of these, I strongly suggest giving this a try. Before we finish, I want to mention one supplement that surprises a lot of people, and that's vitamin B6. Many neuropathy products contain high doses of B6 because it's involved in nerve function. But here's the catch. Too much B6 can actually cause neuropathy. Yes, the very symptom people are trying to treat. That's why more is not always better when it comes to supplements. Always check the label. If you're living with nerve pain, I know it can feel discouraging. I've spoken with many people who feel like they've tried everything. Some feel frustrated because medications didn't work. Others are tired of being told to just live with it. Please don't lose hope. While there may not be a single solution that works for everyone, many people do find improvement through a combination of approaches. Sometimes it's better blood sugar control. Sometimes it's physical therapy. Sometimes it's a medication. Sometimes it's a supplement. And often it's several small changes working together. The goal here isn't perfection. The goal is improving your quality of life one step at a time. If you found something that has helped your nerve pain, I'd love to hear about it in the comments below. Your experience may help someone else who is struggling. Thank you so much for watching. My name is Pharmacist Michael. Be happy, be healthy, and I'll see you in the next video.